Do you frequently feel like your heart pains sometimes? Or maybe your baby keeps getting sick with rashes, bad diarrhea, and constant fevers, even though they're eating well and being cared for. What if it's not just a common infection, but something deeper going on inside the body's defense system? That's where Omenn syndrome might come into play. Imagine your immune system as an army protecting your body. In Omenn syndrome, this army is not only weak, but also confused. It starts attacking your own body while failing to fight germs. It's very rare and mostly shows up in newborns or babies under 6 months. If a baby has severe rashes, unusual hair loss, swollen lymph nodes, and keeps getting infections, doctors start to suspect something like Omenn syndrome. Have you ever seen a baby who looks very sick without any clear reason? This could be why. So what causes such a strange situation in the body? Omenn syndrome happens because of mistakes in a baby's DNA. Yes, the same DNA that you inherit from your parents. These mistakes are in genes that help build the immune system, like the RAG1 or RAG2 genes. Think of these genes as instruction manuals for making soldiers, immune cells. If the manual is damaged, the army gets built wrong. Some soldiers never show up, and the few that do are confused and attack the body itself, like a guard hurting the house instead of protecting it. Most of the time, both parents carry a small hidden glitch in these genes, and the baby inherits the broken version from both. It's like getting 2 faulty batteries. The flashlight just won't work. This is why Omenn syndrome is called a genetic or inherited disease. It's not caught from someone else like a cold, so you can't get it from hugging a sick baby. But the baby gets it because of the genes passed down. A 2-month-old baby has red peeling skin all over, not just a little rash, but one that covers the scalp, face, and body. The baby also has no hair or very little, which is unusual at that age. Now imagine the baby is always crying, not gaining weight, and has constant diarrhea, even if mom is breastfeeding perfectly. The lymph nodes in the neck or groin feel big and swollen, and the liver and spleen grow larger too. The baby might get pneumonia or really bad blood infections that come back again and again. Blood tests would show too many of one type of white blood cell, T cells, but almost no antibodies, B cells. Here's a way to relate. Normally, your immune system has different types of fighters. Some identify the enemy, others make weapons, antibodies. In Omenn syndrome, only one type shows up, and they're out of control. So, if you're a parent and notice your baby is not just fussy, but truly unwell with these signs, it's time to ask for more than basic medicine. First, they ask about family history. Did any relatives have early baby deaths or immune problems? Then they do blood tests. These show strange immune cells, high IgE, an allergy-type antibody, and low antibodies. Genetic testing is the key. It checks for broken RAG1 or RAG2 genes, like finding typos in the instruction manual. Sometimes a skin biopsy, a tiny skin sample, shows immune cells attacking the skin. Once confirmed, treatment starts fast. The only long-term cure is a stem cell transplant. Think of it as replacing the whole broken immune system with a healthy one from a donor. Before that, babies get IV antibodies, helping the body fight infection, special formula, steroids to calm the overactive immune cells, and isolation to avoid germs. It's like rebuilding a city after a storm. First stop the damage, then rebuild with strong new materials. Without treatment, most babies don't survive past their first year. Can Omenn syndrome be prevented? Not exactly. Since it's genetic, you can't stop it once the baby is conceived with the faulty genes. But families can take steps before having kids. If you already have a child with Omenn syndrome, or know of immune problems in your family, genetic counseling can help. Doctors can test parents to see if they carry the faulty genes. Then, during pregnancy, tests like amniocentesis or chorionic villus sampling (CVS) can check the baby's DNA before birth. It's like checking the blueprint, before building a house. If both parents are carriers, there's a 1 in 4 chance in each pregnancy that the baby will have the disease. Knowing this risk helps families make informed choices. Also, newborn screening in some countries may one day detect such diseases early, but it's not common yet. So, prevention is more about awareness, testing, and planning, not something you do after birth. Scientists are working hard to understand how the broken genes lead to confusion in the immune system. They are studying gene therapy, a way to fix the faulty DNA without needing a donor. Imagine injecting good copies of the RAG gene into the baby's own cells to correct the instruction manual. Early trials in animals show promise. Also, researchers are improving stem cell transplants by using half-matched family donors, which increases chances of finding a match. Some teams are looking into drugs that can calm the overactive immune cells before transplant. Another cool advance is using CRISPR, a tool that can edit genes very precisely, like using a pencil with an eraser on DNA. While these are still in labs or early human trials, they give hope that one day, Omenn syndrome could be treated earlier and more safely. So even though it is rare, science is not ignoring it.